Levine's conservation model or the theory, Levine's conservation theory. Theory is a set of concepts, ideas, and proposition and interrelationship of the concepts in order to predict the systematic view of some phenomenon. So, any theory you take it, theories are trying to explore their views and ideas in order to give the better healthcare and how to approach for the healthcare and improve our nursing skills towards the patients. So, before going to this theory, who is she? The Levins. Levins, her name is Myra Estrin Levin. 1944, she received the diploma in nursing at the Hook Country School, Chicago. 1949, Bachelor Science in Nursing from the University of Chicago. 1962, Master Science in Nursing from the Wayne State University, Detroit. 1969, she published the Introduction to the Clinical Nursing. 1977, she received the Elizabeth Russell Belford Award for the Excellence in Teaching Sigma Theta Tau. 1996, on March 20th, at the age of 75, she died. Levine's concept mainly about this nursing care, she is addressing that the total patient's care has the two components. She is telling that conservative principles and organismic response. Organismic response is she is talking about the patient. And the conservation principle, she is talking that the nurse has to mind with these two things we have to keep in mind while giving the care. So, telling intervention as a conservation activity. Intervention according to the conservation activity. Why this conservation is very important? What all the conservation is there in the organisms? This how the organisms are responding. So accordingly, responding, how he responds, where he responds to the environment. She is telling what is environment and she relating that his response and where is our nursing intervention. She is talking about this model or the theory. Let us see clearly. The intervention as the conservation activity. Let us see what is conservation activity. Conservation of energy. This is the constant renewal of energy. For example, we take something input, it should come output. There should be a balance between the energy input and the energy output. Especially in order to improve our health, it is very essential. Then conservation of the structural integrity. What's called structural integrity? To prevent our it's like restore our body elements and prevent anything loss, and it's like to prevent the physical breakdown and to promote healing. Everything you should need restore some of the bodily elements, either the whatever elements, RBCs, WBC, whatever she is meaning that we have to restore those elements to maintain our structural integrity of any individual. She is talking conservation of the personal integrity. She is talking about everyone is unique and every individual to maintain, restore their own self identity. No one is like that person with the specs, that patient with this color shirt, he doesn't like to that. So she's telling that the patient can be called by the name and respect their privacy. That will improve the conservation of the personal integrity of each patient. And then conservation of social integrity. That means every individual is a social animal and the individual need interaction with another social being. So he need the social acceptance and social affiliation from others. So health is also determined by the socially also determined. So she is talking this conservation energy is very important for any human being. So our care, nursing care also based on this. Nurses should know what all the energy does you need. And the organismic response. He is talking about there is any person want to survive, he must adapt to the environment. So this adapt to this environment is called rudimentary. This rudimentary or the point or the person's response. So it's the environment, what kind of a stressful environment he is getting, how he responds is an important. That's a rudimentary. Rudimentary may be according to his situation. Sometimes if a person perceived some of the threat, either maybe the fight or like a flight or fight response he will be showing. That is his response. Sometimes he may be infected, or he may be getting some injury, diseases or typhoid or any fever. There will be a bodily response is there. That's called, he's telling that, inflammatory response. Sometimes stress, the patients are newly diagnosed with some of the diseases, or the patients getting amputated, so immediately he will go on the stress and acceptance. There may be stages. So she's telling that the bodily response, all the systems, like it takes time for the individual to respond. It's like a psychological, social, how he take it to the limb amputation. She's telling an example. Then sensory response, it's based on the person's perceptual awareness. Like how he use of the senses used to gather the information from the environment, and how he perceive with the environment. These all the matter for the nurse to give care. So the nurse has to understand in his care, she has to understand, she has to remember that the two things while giving the care, that is total patient care, it's a component is only two. That's a conservation principle and organismic response. So this is the one how the nursing care should be. She's telling that adaptation and assessment. So like adaptation and assessment, rational for nursing intervention. That's the main rationale for the nursing intervention, how it should be. Nursing interventions are used during the patient's adaptation, how he adapt to this and his response to the illness. So this will be help the person to restore his patient's wholeness, integrity and the well-being. I have made this Levine's concept into the pictorial manner. So she is telling that a person means he is a holistic individual, he is an open system. Any person or the individual, he is striving to maintain the four integrity. As we discussed, what are all the four integrity? Like he is striving to maintain those integrity, conservation of energy, or conservation conservation of structural integrity, conservation of the personal integrity, or the conservation of the social integrity. These kind of a four acceptance or the integrity, he wants it, right? And so holistic individual is an open system and striving to maintain his personal, social, all integrity, and he also having a sense of response. Every action have a different response, right or not? So he may have a response, that's what. And then fight or flight response, any stress or any threatful condition is coming, either he will think whether I can stay and fight or I can run away from the situation. And any inflammatory response according to his bodily response, like how WBC is acting upon. So any individual, all these things will be have. And response to the stress, like how he is responds to the stress, that is also there. So any person is like this, and she is telling any individual or the person is constantly interacting with the environment. So according to according to Levine, she is telling environments are the three kind of environment, like the perceptual environment, how the individual is like five senses, like seeing, hearing, smelling, what he is taking into the senses, what he is seeing around him. And the operational environment, like the physical environment, like pollution, radiations, and how it does affect him. Then conceptual environment, how he believes, traditions, ideas, views, thoughts from the other people, all the culture, values, everything is an environment. So social environment, she is talking about the conceptual environment. So is the person, these all may be giving, this environment, this is called the external environment. This may bring stress, that's called the external stressor. So what is internal stressor? Bodily response. So any body response, his immune system is weak or something, that also give me, that's internal stress. So whatever the stress factor, this stress factor is going to affect the individual. So this is the concept. So he is telling the person is an open individual striving to maintain his own integrity, personal, social integrity. And he has a sensory response, fight or flight response, inflammatory response, and response to the stress. And this person having around him some of the environment. He has the internal environment and the external environment. So constantly he is interacting with the environment. So also she is telling that this individual is any individual trying to adapt with this one. Here she is telling that our intervention should be how it should be. The nurse has to observe and assess the persons, assess and adoption. He trying to adopt, right? He already trying to adopt with all these external, all the stressors, and his self identity and integrity also he is striving to maintain. So he is fighting between this inflammation, stress, and also maintain his integrity, and he has to respond to this. All this conflict is within him. So our nursing intervention, she is talking at observe and assess him as well as his environment. Also, your intervention, you have to plan. How you have to plan? First, you assess and assist. So, assessment is nothing but how is the adaptation, how far he is adapting. So, assist and observe and use the conservation principle. In this principle, which point where he is striving to adapt, where he cannot able to adapt, you have to understand. So you apply your knowledge and skills and any technique or anything, make him to participate with your intervention and helping him to adapt with this like striving to achieve the integrity, and help him to fight with this environment. And gradually, if the intervention is good with your scientific knowledge and help, and gradually this individual output will be good. What is the output continuum is telling? The adaptation to the state of the health. He will promote his wholeness and integrity and wellness. She is telling that's the health. So it will helpful for him to adapt. He promote his wholeness, integrity and the wellness. So whatever she told the concept, I put into this in the continuum. So she is talking only two about this nursing intervention, about the two. We have to understand about the like a conservative principles and organic response. Any individual means he responds, either the positive or negative response. So this response only help him to lead to the health or lead to the illness. So our nurses, we are the nurses, we have to observe and assess his integrity where he need help and where this finding problem in adaptation, and we have to use our knowledge and skill and observation and knowledge and skill, make him to participate with this. So you will help him to sustain his integrity, positive responses, and will gradually he will promote his wholeness and integrity and wellness. So this continuum is clearly explaining about the Levine's concept, who is individual, what is environment, how the nurses, what is the role of the nurse, how she has to interact with the patients, and any patients is an individual, he need respect, how to call him if any tragedy coming or he cannot accept if HIV positive or amputation, how he responds to the stress, and you have to give him counseling and use the scientific knowledge in order to achieve, promote the wellness, individual's wellness and integrity of the individual. Let us see the Levine's Metaparadigm. So as a person, she is telling person means it's a holistic individual. So it is an open system. It is an overchange of the organisms and striving to adapt with the environment, because it's already we told you it's he is striving to adapt with the environment, and his experiences orderly sequential changes. And we changes through the adaptation. Health and illness are the pattern of how his adaptation changes are there, and survival by using own 4 responses. His survival depends upon the response. So she is talking about a person means it's an open system, ongoing. He interact with the environment, striving to maintain his integrity. So he trying to maintain with integrity, and always he will be response. This response will help to maintain his health or something. This is the person or the individual she is telling. And the environment is very well, she is talking about the internal environment and the external. That's what we shown in the this one we have shown in the continuum. Internal environment, bodily response, or the external environment. We told about the perceptual environment, 5 senses, what I perceive, what he perceive it, and then operational environment and conceptual environment. So that's a social and physical environment only, they put it in operational, but all the pollutions and other things around him, the physically what's present in the environment. And next one is the health. She's telling health is a pattern of adaptation or the change or the viewed to the continuum. Like viewed as a continuum. How this continuum, well balanced continuum, how you are striving to adopt. So I put it in a continuum form. So she's telling that like this involves in the it involves in a gradual adaptation in the continuum, various fluctuations, problems, stressors, all this coming, but health in the sense he has to take everything, strive his integrity, and gradually he should output and achieve his own health, she's telling. About nursing, she involves in the human interaction and promote the wholeness and the depend on the she's telling that alternative nursing diagnosis you have to use, alternative interventions, because every patients are unique, every stress is different from the one person to another person. So she's telling assist the individual to adapt with this health status where he want to adapt it. Nursing means it does require the skills and scientific knowledge, and also she is telling that use the conservation principles like conservation of energy, conservation of social integrity, conservation of the personal identity or integrity. Everything is give respect to the person. So if you give the respect to this personal identity, you give him respect, it will improve the participation with the patients with together in the intervention. He will really will cooperate. There will be a participation. There will be involvement in this. Involvement leads to the achievement. What is the achievement? The achievement is nothing but the promotion of the wholeness, integrity, and wellness of the individual. So the nursing is the active participations every aspect of the person's internal and external environment. So the concentrate in alternative state of altered state of health. So where his health is altered, maybe the stress related, where you have to intervention. So intervention is the nursing's unique. So she's always telling assist and assess and observe. So this is Levine's model. It's very beautifully explaining. So I have go through that. I put it in that model form so that I put all the concepts in one model. So it will be very easy to understand rather by in write-ups. If you draw this model and where and all you can apply. Any individual you can apply this. So either the all kind of the patients you can easily apply this theory. Thank you.